Hey, it's Dr. Modi from Gastro Office. Today we're going to talk about hemorrhoid banding. A lot of my patients, by the time they're 50, they've experienced some sort of symptoms, whether that's anal pain, rectal itching, seepage, excess wiping. All these are very common findings when we have hemorrhoids. So the way I like to explain hemorrhoids is the last 6 inches of the colon is called the rectum, and the exit, where poop exits, is called the anal canal. Now the rectum is very vascular in nature, and when we sit on the toilet, sometimes we may have not had enough water or fiber intake, and we're really pushing and straining, and that can increase the pressure at the bottom, and that can develop in hemorrhoids. Now, a lot of people have tried a number of things before they come to see me. That includes fiber, they've tried sitz baths, they've tried topical creams, and nothing seems to improve that. And over the last decade, there's been a transition to doing a non-surgical approach to treating these hemorrhoids. I like to describe to patients, hemorrhoids are usually in 3 columns, and this is option of banding has come across where it's non-surgical, it's typically pain-free, there's no sedation or prep involved. And what we're able to do is we are able to have you lay on your side, insert the device, and we would suction up tissue and deploy a rubber band. And we do this in 3 sessions, 2 weeks apart. Each session is about 5 minutes. And the benefit here is that it's cutting off the supply to the hemorrhoid. So you don't necessarily need to worry about specific treatment of one hemorrhoid because we're actually treating all 3 columns within the sessions. And a lot of patients have reduction in symptoms, almost to the point where they don't necessarily need to even worry about that pain or bleeding, or excess wiping. And it's really important once you get treated for your hemorrhoids to also stay on top of things, meaning, increase your water intake, continue with a high fiber diet, make sure you're exercising and staying active. All of those things do play a role. And then most importantly is your hygiene when you're having a bowel movement. Don't sit for many minutes, maybe 1 to 2 minutes, and then if you're having to strain and it's not coming, get up and try again in a little bit. As well as, when you are sitting on the toilet, just be conscious of how much pressure you're putting as well. So if you're able to find that you haven't had benefit with conservative management, I think it's really important to consider hemorrhoid banding as a next option.